Okay, so before we get started, I'm gonna explain to you guys about the social issue, the background, the purpose, and also the focus of our campaign, which is breast cancer awareness. So, surprisingly, every 15 seconds, there is a woman somewhere in the world who are diagnosed with breast cancer, and there are more than six women die due to the breast cancer in every 5 minutes worldwide. So as for background, breast cancer literally afflicts an estimated figure of more than 1 million women in the world each year, and it is the second leading cause of cancer death among women worldwide. So basically, these campaigns are created in order to spread the awareness about the breast cancer to the public. So as for the purpose, we can see that the purpose of this campaign are to highlight and give an exposure about the importance of the education and early detection, whereby the early detection can be done by individual itself. As for focus, we are trying to raising a fund through a social welfare department, educate the youngsters about the breast cancer, and give the support to the cancer patient mentally and physically.
Step 2 is analysis situation. For our strengths, our company focuses on the breast cancer awareness and wants to provide early protection to the women there who are busy with work. Not only that, our campaign also want to give awareness to the teenagers, girls especially, who are now taking it easy on these cases. Our campaign is not only focused on the victims or survivor. We also want a woman who previously did do not know about this cancer to be vigilant. Our campaign also provide the free coaching for the women that interest with our campaign to schedule their annual mammograms. Next is witnesses. For our campaign, there's few witnesses that we have found, which is we need to work hard to win our hearts of women. This is because many of them underestimate this cancer. It also hard to get attention from a woman and girl that not familiar to the case. Some of them think that this is not important to check on themselves. Next is opportunity. From this campaign, we will able to detect this disease from the beginning. So it will help women out there to spread this campaign in order to always remember of this cancer. Victims or survivor itself will more appreciate on this campaign because they will always remember. It will make them to invite others to join this campaign. Lastly, is trade. This campaign only focus on the women in Malaysia, so it is quite hard to give them exposure. This cancer usually affect the older women and also a young women that are not particularly in taking their diet healthy. The trade of our campaigns also come from the other organizational because their campaign would be more attractive from us.
Okay, so as our priority audience, we choose women and also a girl student. So this is based on the traditional segmentation, and the audience, we choose this kind of audience because they literally the people who had the high risk to get a breast cancer. So by educating the girl student about the early detection of breast cancer, they might have an idea if there's something wrong with their body. Meanwhile, as for women, we might provide physically and mentally support to those who had faced the cancer. Okay, so right now we are going to talk and discuss about the objective and also the goals of this campaign. Whereby, as for the objective of this campaign is to provide the best source of accurate and up-to-date information, especially about the prevention, early detection, treatments, follow-up care, and supportive practice for women who are diagnosed with the breast cancer. As for our goals for this campaign is to raise the public brand's awareness for the breast cancer, about its early detection, its treatments, and the needs for a reliable and permanent cure. So with this kind of goals and objective, it will help us focusing more in our campaign, whereby we can have a clear direction of what kind of things that we should and shouldn't do. As for this case, we might focusing on giving an exposure to women and girl students about the breast cancer, the prevention, and how to detect it at the early stage. So we might also give a support mentally and physically.
Stage 5 is about barriers, benefit, motivation, and others' influence. For our campaign, there is some barriers, which is there are many campaigns about breast cancer, and so it is hard to get attention because some of them already join others organizational. But there's also benefit from our campaign, which is any woman and girl that are not taking part in any breast cancer campaign can join us and get a free medical checkup and free consultant from us to schedule their mammograms. Our campaign can be a motivation to others, women and girls, because it is about health. Breast is one of the important part of our body, which is woman. This campaign provide a free medical checkup, and so women that come to join our campaign can be have a chance to improve their lifestyle. Lastly is influence other. For our campaign, we use influencer and Insta famous to get attention from women and younger out there. This is because people nowadays really like to follow the viral things that do by influencer. So when our campaign become viral through the Insta famous and influencer, they will follow to get checkup and do some appointment.
Desired positioning for the campaign breast cancer awareness, we want to approach the community, especially the women. We want them to believe and we want them to know that the breast cancer is very dangerous for them, and we want them to understand that early diagnosis and early detection or screening is very crucial and fundamental. So we choose to use the branding strategy to secure this desired positioning.
Stage 7 is strategic marketing mix. We go through the first P, which is product. Our core product is actually to get some donation to provide the tools for mammograms. From this, the women and girls can get knowledge, get some education about breast cancer, which is they can have a self examination. And also our campaign help to get the annual mammograms at the hospital and clinic. Next is price. We use the monetary and non-monetary strategy, which is we use monetary because it costs in doing mammograms and to do the next consultation, while the non-monetary which is they can do their own exercise to find the lump in their breast. Next P is place, which is we usually do the campaign at the hospital and clinic because it is easier to get the audience, and sometimes we used to do the campaign at a workplace. This is because the women that have a work are usually busy and there is no time to go hospital and clinic. Lastly is promotion. This campaign will be promoted on social media because we know that this day many people spend their times in their gadget. So we also use the influencer in order to attract the target audience because they are easily to follow their favorite influencer. We also use the traditional promotion, which is we're going to push the girls students at the university, at the school, to make to attract them and make some activities with them.
As we all know, breast cancer awareness was planned to measure and track the awareness of the danger caused by the breast cancer itself. So the plan for monitoring and evaluation, There are a lot, so we highlighted two main points, which are number one is create hotline center, which is they can make the target audience which are women. They can get more information, and they can ask through the phone about the information about the breast cancer itself. Another one is appoint special facilitators, so that when they call through the phones, so they can just ask anything about the breast cancer to the specialist, especially in cancer. For funding and budgeting, we want to approach two main sectors, which are media partners and corporate sponsors. For media partners, we want to approach, for example, Astro, and for corporate sponsors, we want to approach, for example, Nestle and Sandabi. Last but not least, the implementation plan. We want to use the 3 years planning. For the first year, we just want to concentrate on the awareness building only. And then for the second and third year, we want to add more elementaries to belief and behavior change of the target audience. Maybe they want to go through the screening every month and do the early diagnosis of the breast cancer, because they already aware of the danger caused by the breast cancer. That's all from us. Thank you.